Depakote is better for mania and Lamictal is better for depression. This is the oversimplified answer to this question. What's up, everybody? Dr. Michael Barnes, psychiatrist. Depakote versus Lamictal. Depakote, also called divalproex or valproate or valproic acid, and Lamictal, also called lamotrigine. Both there's a lot of similarities, quite honestly, between both of them, so we can talk about the similarities. They're both anti-epileptic, anti-seizure medications. I always say any medicine that goes to the brain, we studied in psychiatry, and this is an example of that. We studied many anti-seizure meds, and it turns out many of them are good for mood and mood-related symptoms. So specifically, Depakote has some data to show that it can help with acute mania or even mixed episodes. And I try to approach bipolar disorder at times through thinking of the different phases, and there's 4 phases of bipolar. You could think of it as bipolar depression, mania, mixed, or maintenance, meaning you're well and you want to stay well. And you can do clinical trials in any one of these areas. So if you're talking about bipolar mixed or mania, then I think particularly you're going to start thinking about Depakote more. Now, lamotrigine, on the other hand, is maybe better for depression and admittedly is not as good for the manic symptoms. The other pros and cons to each of them are just some kind of things to separate the two. Depakote may be, in my opinion, quote, stronger, for lack of better words. Certainly would be more studied in things like aggression, irritability, agitation, violence, or similar, but does come with maybe some more blood monitoring in comparison to lamotrigine. Now, lamotrigine may be lighter in that sense, but does have one potential very serious side effect that is usually pretty easy to avoid, but it's called Stevens-Johnson syndrome, which is a type of autoimmune process that could affect the skin and other organs. So I hope this kind of helped. Hit me up